Welcome to Mental Health Matters with Viking Psychiatry. Okay, so access to mental health care is a growing concern statewide, especially in rural areas. And a new $50 billion federal program could transform access. But Indiana's current law may prevent us from fully benefiting. Joining us today is Goddard from Viking Psychiatry to explain how nurse practitioners and psychiatrists work together and how state regulation could affect Hoosiers' access to care. Good morning, Sean.
Good morning.
Welcome.
Thank you.
Yes. Okay, so let's dive right in. Something that you've said before is the fact that nurse practitioners and psychiatrists are not competing with each other. What do you mean by that?
Absolutely. So nurse practitioners and psychiatrists, we're really teammates. We're not competing, we're collaborating together. And we share the same mission, right, which is helping Hoosiers get the mental health care that they need. When both professions work together at the top of their training, patients really get faster access to care, lower costs, and ultimately more comprehensive care. Collaboration with each other is what makes outcomes much better for really everyone.
Yes, and you said that advanced treatments in northern Indiana exist because of nurse practitioners. Can you expound on that?
Yeah, across many of the counties in northern Indiana, and not just northern Indiana, there aren't enough psychiatrists available. Because of nurse practitioners, treatments such as TMS, deep TMS, Spravato, ketamine therapy, and even advanced neurostimulation are now available in these communities because the NPs have filled the critical gaps, allowing people to receive care locally, right, rather than having to drive hours or potentially go completely without care.
Okay, so you've mentioned before about clinics and the fact that they have strong collaboration within physicians. So how exactly does that impact the work that you're speaking of?
Yeah, so more specifically with us at Viking Psychiatry, we're incredibly lucky. We have an incredible collaborating physician who really believes in NP practice, supports our clinical judgment, and shares our commitment to access and innovation. Really, that support is the reason I'm able to offer the advanced treatments that we do safely and effectively. But not every practice is that fortunate. Many nurse practitioners across Indiana are forced to pay thousands of dollars a month just to maintain a collaborating physician contract. Now, that's money that's not going to the patient care. That's not going to. It's money going to for the practice to have permission to be in business. And if that collaborator ends that contract even suddenly, think illness, death, moving, it happens, that NP can lose their ability to practice overnight.
Wow, really? Okay, so that's deep. So let's dive into that a little bit more. So why is it that Indiana's collaboration is such a problem?
Yeah, because really what it comes down to is the entire practice, including mental health services for thousands of patients, is tied up into a private contract that can be canceled at any time. If that physician retires, moves, chooses to end their agreement, NP clinics can be forced to shut down immediately, same day, not due to safety, not due to quality, but because of bureaucracy. This places the clinic, the staff, and more importantly, the patients at risk.
Okay, and so what you're speaking about, really contradicts Indiana's policy and their goal with that.
Yeah, and I think you could really understand this, right? Indiana aims to expand access to care, support small healthcare businesses, and really strengthen rural healthcare, where we struggle the most. Indiana does require nurse practitioners to have that collaborating physician agreement, but the law doesn't define the physician's responsibility. There's no required oversight, no chart review, no mentoring, no participation expectations, and no state enforcement of what the collaboration means beyond a simple requirement that they review 5% of charts randomly. It allows a single contract with no due process or protections to determine whether thousands of Hoosiers to lose access to their care. And I can absolutely assure you, there is no other profession in the state of Indiana that is put in that position.
Wow. That's amazing. And so just recently, the CMS announced the fact that a major initiative of $50 billion dollars in
Right.
rural health transformation program. So how does this tie into this issue exactly?
Yeah, it's really one of the most important pieces of this conversation. CMS, the Centers for Medicaid Services, created this $50 billion rural health transformation program to really strengthen healthcare in rural communities nationwide. It's where we struggle the most. And here's the critical part. CMS will score each state based on how they support the area of nurse practitioners and whether they have full practice authority. Where an NP can practice independently will score the highest, right?
Yeah.
And receive the most amount of that federal support. Meanwhile, Indiana is considered a reduced practice state, so we will score lower, which appears to be about a 50% reduction, and rural Hoosiers could lose out on a share of an estimated $437 million in potential funding due to this. So this isn't just a policy issue, right? It's a dollars and access issue.
And so basically Indiana has not moved this bill forward. Is that right?
Yeah, absolutely. Consistently, we've introduced bills to modernize MP practice laws. Every time they die in the Senate Health and Provider Services Committee, chaired by Senator Ed on the House side, and they are assigned to the House Public Health Committee, excuse me, and they never advance. That chair is Representative Brad Barrett, MD, and as such, the restriction of the movement of the bills, which was most recently HD 1330 and 1116, prevents Indiana from joining 27 states that already grant full practice authority. Not only that, the VA and the military both practice the same way. Nurse practitioners have independent practice. I think Hoosiers need to wonder why this isn't being heard upon and decided upon by the large body, not just by a few individuals saying, we're not going to allow this to move forward.
Okay, so at this point, in your opinion, do you feel that this is where the governor needs to step in?
Yeah, absolutely. If we haven't been able to do it on our own with the Senate and the House, then the governor needs to step in. We're at a turning point. Thousands of Hoosiers, not thousands, tens of thousands of Hoosiers rely on NP-led mental health services. Other states only made progress when their governors stepped up and recognized that the outdated restrictions were harming access to care. More importantly, with this $50 billion in federal funding on the line and a mental health crisis that's growing, we need leadership that prioritizes access, safety, and the future of healthcare in Indiana. And Mike Braun has said, make Indiana healthy again, right? And this is one way we absolutely can do that.
So what's at stake then if nothing changes?
You know, if a collaborating physician ends a contract for any reason, NP practices can be forced to shut down overnight. There are not enough psychiatrists to absorb those patients. Thousands, if not tens of thousands, could lose access to their medications, their treatments, and their progress. And rural Indiana could miss out on the largest rural healthcare investment in U.S. history. We can't allow that. We as Hoosiers deserve reliable, stable, long-term access to mental health care in the state of Indiana.
Yeah, wow. That was some good information. So thank you for having this important conversation and kind of giving us an idea about the general state of our mental health well-being right now.
I appreciate you having me on and helping me shed light on this issue.
Absolutely. Thank you, Sean. And if you would like more information about Viking Psychiatry, we'll have their website listed below, and I'll see you after the break.
This segment sponsored by Viking Psychiatry.